For a reality check now on the state of the pandemic, I am joined by ABC News contributor Dr. Alok Patel of Stanford Children's Health. Thank you so much for joining us.
Hannah, thank you for having me. Thank you for the discussion.
Of course. So as you can imagine, so many of us were hoping we're done with this pandemic. But as Dr. Fauci said this week, it might not be done with us. So in your view, do we need to be concerned about this BA2 subvariant? What do these rising cases mean for the near future of Americans?
Well, Kana, the numbers tell us exactly what you just hinted at, is that we're not done with the pandemic as much as we want to live like it's 2019. The reality is right now we're still losing over 1,000 Americans a day. And I don't want to say that we should blanket be concerned because we're in a much better place than we used to be with the level of vaccine and natural acquired immunity and the amount of treatments that are available. But the people who are paying close attention to this, or who should be, are those who are elderly, those who have underlying medical conditions, who are immunocompromised, or anyone out there who is still not boosted. You heard the statistic during the Omicron surge. A 3-dose vaccine regimen was giving people greater than 90% protection against death. If you look at any other preventative measures in public health, whether it's life jackets, helmets, or seatbelts, that number is astronomical. It is beyond me why anyone out there will not go and get these vaccines when we know for sure that they are protecting us against any variant that's out there, including BA2.
That is a really interesting comparison. And of course, I mean, a lot of us just took our masks off. We're finally feeling normal. Do you think that people are really going to be willing to put them back on?
It's going to be difficult to actually get people to go back and put their masks on. But I think some reassuring things that we can point to are what polls have showed. Now, in the middle of February, a Kaiser Family Foundation poll showed that about 56% of Americans wanted indoor mask mandates back in place. A recent poll of LA union teachers said that more than that, more of those teachers wanted indoor masks in place in schools. And then, a recent poll, another recent poll, Axios Ipsos poll, showed that about 3 out of 4 Americans said that if virus numbers went up, they would be okay with wearing masks again. So I am hopeful a large percentage of the population, especially those who are at risk, would go ahead and put masks back on. But I think we may have rushed lifting masks when we went from one day saying 90% of this country is high risk, put a mask on, to all of a sudden the following morning saying, hey, 71% of the country is in the clear, take those masks off. It's hard to bounce back and forth between those mandates for a large population who doesn't like being told what to do.
I get that. And you saw how quickly, though, people did want to take their masks off. So at this point in the pandemic, what about that? What about giving Americans the option for personal responsibility to make their own decisions about masking if these cases do surge, rather than make a mandate?
Well, that would be the ideal scenario, to give people that autonomy. But the reality is that these decisions affect your community around you. They affect anyone else around you who might be high risk. And also, if people do go and get sick, they are then going into hospital systems. And we unfortunately don't have the most robust hospital system in times of surges. And we saw this play out during previous surges in this pandemic. This all gets me thinking back to the 80s when seatbelt mandates were introduced, New York State being the first one, and people fought back against it. And I think it goes back to the fact that people just don't like being told what to do. They want to take responsibility of their own actions. And unfortunately, some people out there aren't paying attention to the community around them, in which they need to, especially when it comes to measures like getting vaccinated and or wearing a mask.
And what about parents of young children? Many eagerly awaiting approval of vaccines for children under 5, but also many parents would prefer not to vaccinate their young children. Of course, where are we at in this approval process? Do you think, in your opinion, that it is vital that healthy children be vaccinated against something that in many cases has little to no impact on them?
Well, I wouldn't go as far as to saying it's little to no impact, because even if children aren't winding up being hospitalized or worse, we're still seeing the effects of kids getting severely sick, having long stretches of cold symptoms, developing long COVID, or passing it on to others. But Ken, I think it's vital that parents are given the option, especially parents of kids who have underlying medical illnesses. I've taken care of kids under the age of 5 who have cancer, who are on immunosuppressant medications, and those parents are freaked out, especially as the world is opening back up. I unfortunately don't think we're going to see an approval for these vaccines within the next month, maybe a little bit longer. And so it's just a little bit of a waiting game, as so many people, parents of the 18 to 20 million kids under the age of 5, are wading into these uncharted waters, which is even more reason we need to do everything we can to protect those who are most vulnerable.
Right. It's really a different situation if you don't have a healthy child at home.
It really is. And, I think if the last years have taught us anything, our health and our resources are something that we should feel privileged about and we should not take for granted.
Well, we appreciate your time, Dr. Alok Patel. Thank you so much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.